Okay, I understand that Humana has opened. So I'm going to show everyone who needs to go through Humana to get to the discounted pricing for AHIP. I'm going to show you how to actually do that. And I know some of you already know this, so it won't be new, but I'm going to share my screen and go ahead and do that. Let me just pull up Humana first. And you are going to go into Humana with the login. Well, I guess I should show you the whole thing. Okay, are you seeing my screen with Humana.com?
Yes. It's in the search engine, but it's not on your screen yet. There we go.
Okay, so now when you're going in, so that you can go to AHIP, you have to sign in with your agent sign in. So when you do that, you're going to go to agent. And it's Vantage. And you want to go over here to licensing, certification, and contracts. And you're going to go to the green button, get certified / recertified. Oh, and there's an error. Let me click that again and see if it comes up. Nope, I have a runtime error and I don't know why. Okay, now it's up. So then your screen is going to look like this. Okay. Required training to complete 2024 Strategic Alliance and External Partner Agent MAPD recertification. That's me because I'm recertifying. You'll go down here to certifications and courses, view all. If it's your first time, you're not recertifying, you're certifying. But when you go through this, and I don't want to click it because I'm already in AHIP, but let's see what happened. Please select the courses that align with your sales type. You're going to be a partner field agent. That's what you're going to select. So you're going to be Humana's 2024 MAPD and PDP recertification for partner field agents. And you're going to click enroll. This course is for field sales agents. That's you. Proceed. And it's going to give you all this information. And it over here, how do you want to complete Humana's recertification? Through AHIP or NABIB? And you're going to do AHIP. I'm not going to go any further into this because I'm already in AHIP, but does everybody understand who's going in through Humana? You understand how you're going to get there?
Yeah.
And if not, you can contact me one-on-one tomorrow and I can walk you through it. Okay, everybody's okay with that?
Yeah.
If you have any questions, put it in chat. Chat actually shows up for me. So we're doing module 2 tonight. It is Tuesday, June 27th. Oh, I have been writing June 27th for so long today. It seems like I should be on another day. It is still June 27th, 2023, and this is Module 2 of the Medicare Health Plans. And in this module, these are the things that you're going to learn. You're going to be able to explain that under the Medicare Advantage program, private companies offer health plans that cover all Medicare Part A and Part B benefits. You'll understand who is eligible to enroll in a Medicare Advantage plan and the possible premiums that they may have to pay. You will identify Medicare Advantage plan types. Those would be your HMOs, PPOs, PFFSs, medical savings accounts, MSAs. You will learn about special needs plans and SNPs or SNPs. You will explore the various types of Medicare Advantage coordinated plans that include health maintenance organizations, health maintenance of organizations with point of service, so HMO, POS, and preferred provider organizations. You'll gain an understanding of the MSA plans, what they do and do not cover. You'll learn about the types of coverage that employers and unions may offer retirees and their dependents. You'll be able to discuss the Medicare rules that apply to individuals who are still working beyond normal retirement age in both the large and small employer businesses. You'll understand that individuals who qualify for both Medicare and Medicaid are considered dual eligible. You will be able to explain how Medicare Advantage enrollees may obtain Part D prescription drug coverage through coordinated MAPD plans or those who are enrolled in the MSA plans through standalone prescription drug plans. You will review other types of Medicare plans, which are not Part C plans, including Medicare cost plans, PACE plans, and Medicare Medicaid plans. You'll be able to identify protection afforded Medicare Advantage enrollees through the grievance and appeals process. So you're going to learn a lot tonight. You're going to, for some of you, learn it, and for some of you, review what you already know. So welcome. And when you go in, this is the screen for those of you who went through Module 1 last night. When you get into AHIP, when you pay and you're able to get into AHIP, when you get to this screen, it will say View Module 1 Training, take the Module 1 review. Because you had the training, you can go click, take the Module 1 review. Is that clear? Everybody understands that. I just want you to know why you don't, because if you click review Module 1 training, you're going to have to go through each one of those slides we went through last night again. And don't forget, over on the left-hand side, up at the top of the navigation bar, you can download the PDF of the entire module. So it's fine if you're not able to get, and you haven't gotten into AHIP, and you're doing the review with us tonight. When you come to this point, you're going to just click, take the Module 2 review. You're going to download the PDF. If you have any questions, you can do Control F and search for the question in the PDF to answer your review questions. So we're going to do the training first. Okay, start the course. The instructions, the navigation instructions are always going to be the same. So I don't waste too much time. You know, there's previous and there's next, and each of these notes are the same for each one of the modules that you start. The terms and conditions The training program is, of course, protected by the United States copyright laws. That's going to be the same in every module. Your learning objectives: explain what types of Medicare health plans are available and who is eligible. Understand the role of special needs plans in delivering care. Describe features of different Medicare health plan types. Describe key issues for beneficiaries eligible for both Medicare and Medicaid, and explain how Medicare health plans work with prescription drug plans. Module 2, Medicare Advantage Plan, MA plan types, coordinated plans, special needs plans, MA plans, private fee-for-service, MA plans, Medicare savings account, Medicare Advantage employer union plans, Medicare Advantage eligibility, cost, and benefits, Medicare Advantage plans and dual eligible beneficiaries, Medicare Advantage and prescription drugs, other type of Medicare health plans, and enrollee protections, appeals, and grievances. Under the Medicare Advantage program known as Medicare Part C, private companies offer health plans that cover all Medicare Part A and Medicare Part B benefits. It's important that you know that and you understand it. So what that means in another way is, if it is medically necessary and covered by original Medicare Part A and Part B, it is also covered in the Medicare Advantage plan. That does not mean that the delivery of the care or the coverage for the benefit will be delivered the same way. However, if you are being treated, as an example, for high blood pressure and the treatment is covered under original Medicare, it is also covered under the Medicare Advantage plan. But the way the treatment is delivered may be different. That's the important thing. Many also cover Part D prescription drug plans. So most of the Medicare Advantage plans that you're going to sell are going to be MAPD plans, not just MA. All Medicare Advantage plans have a maximum out-of-pocket limit for basic benefits. The medical maximum out-of-pocket is just that. It's a medical maximum. It does not include the out-of-pocket costs for prescription drugs, and it's only for covered medical expenses. But every plan has a MOOP, a maximum out-of-pocket. Many Medicare Advantage plans also offer additional benefits that Medicare does not cover. The types of Medicare Advantage plans are coordinated care plans. These plans have a network of preferred providers and include health maintenance organizations, which are your HMOs. Some have a point of service, POS, so you will see some plans, the plan name includes HMO-POS. And that POS piece would allow the beneficiaries to go out of network for certain benefits within the plan. Another type of plan would be the preferred provider organization, or PPO, which can be a local PPO or a regional PPO. A local PPO may only be available for certain counties or one county, and a regional PPO is generally for the entire state. Private fee-for-service plans, those are plans that are entirely different, but they're Medicare Advantage plans. Medical savings account plans are also a type of plan that one can choose. So first, let's talk about the HMO plans. For HMO enrollees must generally only use doctors and hospitals within the plan's network unless it is an emergency. So that's pretty clear. HMO enrollees may need to select a primary care doctor and may need a referral for specialty care. Now you notice it says may need. There's one plan in our area that does not require a referral. It does require, however, a primary care doctor. The primary care doctor is also known as the gatekeeper in the HMO plan, because the primary care doctor is the one that coordinates all of the care for the member in that plan. Some HMOs offer a point of service option that allows enrollees to go to non-planned doctors and hospitals without receiving prior approval for certain services. Unlike a PPO, an HMO POS plan may limit the services available out of network or may put a dollar cap on the amount of out of network coverage. Cost sharing is generally higher for any services that are obtained outside of the network providers. So it says, click on this picture for exceptions. These are the exceptions for the HMO plan. Emergency services received outside of the plan are covered. When an enrollee is temporarily absent from the planned service area, dialysis services are covered outside of the network. Urgently needed services received outside of the planned network are covered when the enrollee is temporarily outside of the service area, or in rare circumstances when the network is not available. If a needed specialist or a covered procedure is not available through the HMO network, the plan will authorize out-of-network services. So those are your exceptions to having services within the HMO and they're outside of the plan's network. Are there any questions about the HMO? You can still use the chat because I think I can see that when you use the chat. For PPO, let's talk about the PPO enrollments. Those are the enrollees who are in preferred provider organizations. They may get care from any provider in the United States who accepts Medicare. They're not limited to network providers. You do not need a referral to see an out-of-network provider, but you're encouraged to use in-network services because you'll pay higher costs sharing when someone chooses to use an out-of-network provider. Regional PPOs are PPOs that are offered throughout an entire region made up of one or more states. Special needs plans. Special needs plans, or what we call SNPs, are a type of Medicare Advantage coordinated care plan. It can be an HMO or a PPO, and they're specifically designed to serve a special subset of Medicare beneficiaries. In addition to meeting all other Medicare Advantage eligibility criteria, the beneficiaries must also meet whatever that specific criteria is for the SNP in order to enroll in the SNP plan. All SNP plans include prescription drug coverage. The first type of special need or SNP plan that we're going to talk about is chronic. So that is a C-SNP. Chronic conditions, C-SNPs are SNPs that restrict enrollment to individuals with certain chronic or disabling chronic conditions, such as diabetes, heart failure, cancer, lung conditions, HIV, or certain other conditions. Not every chronic SNP plan has the same disabling chronic conditions. So each carrier identifies the specific disabling chronic conditions that will allow an individual to be enrolled in their plan. So remember that, because one says, if you have HIV, you can get this chronic SNP plan, doesn't mean that every carrier, that's one of the conditions. Each C-SNP will specify the condition necessary to be eligible to enroll. Dual eligibles, or D-SNPs, who are entitled to both Medicare and medical assistance through Medicaid, are the subset that would get enrollment into a D-SNP plan. Fully integrated dual eligibles are the ones who get the full coverage of the D-SNP plans. Some D-SNP plans will have what's called cost sharing for those people who are not full dual Medicaid members. Here's some other SNPs. This one is an I-SNP. This is someone who is in an institution. Most of us will not be selling institutional plans. Most of the carriers have specific representatives who are trained, and they actually take care of the institutional SNPs. So institutional SNPs are SNPs that restrict enrollment to a Medicare Advantage eligible individual who, for 90 days or longer, have had or are expected to need the level of services provided in a skilled nursing facility, a nursing facility as defined under Medicaid law, an intermediate care facility for the individuals with intellectual and developmental disabilities, a long-term care hospital, an inpatient psychiatric facility, or certain other facilities specified by CMS. Institutional equivalent SNPs enroll Medicare Advantage eligible individuals who live in the community but require an institutional level of care, such as are determined by an impartial entity to need the level of services furnished by the types of facilities listed above. Eligibility for an IE-SNP, institutional equivalent, may be limited to certain assisted living facilities. Again, you won't probably be enrolling anyone to one of these plans, but you need to know that they are available, because someone may have an I-SNP and then they are no longer required to be institutionalized and they leave the facility. Now they have a special election to get a regular or a chronic SNP, a regular Medicare Advantage or a chronic SNP. Private fee-for-service, PFFS. These are very popular in some areas of the country. They're not popular in all areas of the country. There are two types of private fee-for-service plans. Individuals enrolled in private fee-for-service plans may receive covered services from any provider in the United States who is eligible to provide Medicare services and agrees to accept the plan's terms and conditions of payment. They're not limited to a network of plan providers. So if you have a private fee-for-service, you can use a doctor who accepts Medicare services and agrees to accept the plan's terms and conditions. Except for emergencies, enrollees must inform the provider before receiving services that they are a private fee-for-service plan member. And the non-network provider then can decide whether to accept the plan's terms and conditions or not. Some private fee-for-service plans contract with the provider. So there are private fee-for-service plans where there is a network of providers so that you know that when you show them your private fee-for-service card and that's the plan that you have, then that's the provider that can offer you services. And if the private fee-for-service plan has a network, enrollees may pay more. You may have a greater out-of-pocket cost if you were to see out-of-network providers. But remember, you're not tied to a network. You don't have to use the network as long as the provider accepts Medicare services and agrees to accept the payment from the plan. Non-network providers that accept original Medicare may choose not to accept a private fee-for-service plan member. Therefore, an enrollee needs to confirm that that provider of choice will accept the private fee-for-services plan before enrolling in one. These can also, the services can also be on a case-by-case basis. So a provider may determine that yes, they will accept the private fee-for-service payment, and 3 months later or 2 months later decide, no, they're not accepting the private fee-for-service plan payment, and they have the right to do that. Continuation of private fee-for-service plans. Providers are prohibited from charging a private fee-for-service enrollee more than the cost sharing specified in the private fee-for-services plan's term and condition of payments. Cost sharing may include balance billing up to 15% of the Medicare rate only if allowed in the plan's terms and conditions of payment. We talked about balance billing yesterday over Medicare. All providers who accept Medicare are allowed to bill 15% over the approved Medicare amount. So in the case of the private fee-for-service providers, if the plan terms and conditions says that they may use the balance billing, they may bill an additional 15%. Balance billing happens when a doctor is eligible to accept Medicare, but is not a Medicare participating provider under Original Medicare. Under Original Medicare, these non-participating providers are allowed to balance bill up to 15%. That was what I just told you. Private fee-for-service plans may choose whether or not to allow non-participating providers to balance bill their members. Private fee-for-service plans may choose to offer Part D benefits, but are not required to do so. So this is a Medicare Advantage plan type that may or may not have the Part D included. Moving right along to Medicare Savings Account. The Medicare Savings Account is a high deductible health plan which is combined with the savings account used to pay for healthcare expenses during the deductible phase. Medicare contributes money to the beneficiary savings account to assist with paying for healthcare expenses during the deductible phase. The deductible applies even in the case of preventive services that have no member cost sharing under other plans. If the member is in the deductible phase, they must pay for those services. The Medicare savings account enrollees pay for healthcare expenses from the savings account. And then if they use all of the funds in the savings account, the Medicare savings plan enrollee pays out of pocket. After the annual deductible is met, the plan pays 100% for covered services. Let me go back to the statement before because I think I said something wrong. Medicare savings account enrollees pay for healthcare expenses from their savings account, and then if they use all the funds in the savings account out of pocket for the deductible, that should say, but it doesn't say, but it's for the deductible, because then after the annual deductible is met, the plan pays 100% for covered services. The maximum allowable deductible for MSA plans in 2023 is $15,750. However, most MSA or medical savings account will have a substantially lower deductible. Medicare savings account plans cover Part A and Part B benefits after the deductible. Medicare service accounts savings accounts do not cover Part D Medicare prescription drug benefits. Medicare savings account, why do I want to say service? Savings account enrollees must enroll in a standalone prescription drug plan if they want to have prescription drug benefits. And if they don't get prescription drug benefits, they will have that prescription drug penalty, the LEP. Medical savings account enrollees may receive covered services from any Medicare approved provider in the United States if the provider chooses to accept their plan. Medicare savings accounts may not have a network or may have a full or a partial network of providers. All non-network providers must accept the same amount that original Medicare would pay them as payment in full. This is the amount the enrollee will pay the provider before the deductible is met. In 2023, Medicare Advantage, Medicare savings plans were only available in 36 states and the District of Columbia. They're not available for me here in Florida. I don't know where you guys are. Medicare Advantage plans and employer and union plans. Employer and union plans may offer their employees and their retirees and their dependents Medicare Advantage individual plans that are open to the public. Those are the ones that you sell. Medicare Advantage plans that are only available to individuals based on their employer, known as employer group waiver plans. That's a different program. Medicare Advantage plans through a direct contract between the employer or union and CMS, known as a direct contract plan. Employers with less than 20 employees, as calculated under the Medicare secondary payer rules, may be able to offer Medicare Advantage plans to their active employees and their dependents. Any size employer can offer Medicare Advantage to its retirees and their dependents. Employer group waiver plans can be any type of Medicare Advantage plan, HMO, PPO, PFFS, or MSA. These plans are different than other Medicare Advantage plans because eligibility to enroll is limited, and because a variety of regulatory requirements are waived as they apply to the EGWPs. For example, certain marketing and enrollment requirements do not apply to the employer group waiver plans. We will discuss these waivers in subsequent modules of the training. Medicare Advantage eligibility. To be eligible to enroll in the Medicare Advantage plan, a beneficiary must be entitled to Part A and enrolled in Part B. So they must be active in both A and B. They must permanently live in the Medicare Advantage plan's service area. If a beneficiary spends 6 months in or outside of the plan service area, they should only enroll in an MAPD plan with a visitor traveler benefit. Or they should choose a PPO. They must be a United States citizen or lawfully present in the United States on or before the enrollment effective date. And CMS makes this determination. Medicare Advantage plans must enroll any eligible beneficiary who applies, regardless of health status. You may not ask any health questions. And when you're gathering information before you have gotten a scope of appointment, the new rule is you cannot ask for their full birth date. You will be able to say, what year were you born? May I have the month and year of your birth? Are you eligible for Medicare? Yes or no? But you cannot say, what is your birth date? Just a side note for you. MA plans must enroll any eligible beneficiary, regardless of health status. Certain special needs plan, those known as the chronic conditions SNPs, the C-SNPs, can limit enrollment to beneficiaries with certain chronic conditions, such as diabetes, chronic heart failure, end-stage renal disease, cancer, HIV, or other specified conditions. Medicare Advantage, MSA plans, special needs plans, and employer group waiver plans have additional eligibility requirements. The following individuals are not eligible to enroll in an MSA. An individual who receives health benefits that cover all or part of the annual deductible under the MSA plan. Examples would include, but are not limited to, primary health care coverage other than Medicare, Medicare hospice, certain supplemental insurance policies, and retirement health benefits. An individual who is enrolled in a federal employee health benefits plan or is eligible for health care benefits through the Veterans Administration cannot have an MSA plan. Dual eligibles entitled to coverage from Medicare and a cost share through Medicaid are not eligible to enroll in an MSA. An individual who cannot provide assurances that they will reside in the United States for at least 163 days during the current year for which the election is effective cannot enroll in an MSA plan. An individual who has already elected hospice cannot enroll in an MSA plan. Employer group waiver plans, or EGWPs, or direct contract plans may only enroll Medicare beneficiaries who are active employees or retirees of the employer or union offering the plan. A beneficiary's enrollment in an EGWP must be based on receiving employment-based health coverage from an employer, union, group health plan sponsor. Coverage obtained through a professional or another type of group association would not make a beneficiary eligible for an EGWP, except to the extent that the coverage obtained through the association can properly be characterized as employment-based group health plan coverage. Medicare Advantage plans may charge a premium. If the plan charges a premium, beneficiaries must generally continue paying their Part B premium in addition to the monthly plan premium to remain enrolled. Medicare Advantage plans may also require that members pay a portion of the covered services they receive. This is known as member cost sharing. There are several potential types of cost sharing. There are deductibles, which is a set amount that the member must pay before covered services are covered through the health plan. Copays is a cost sharing method, and it's a fixed dollar amount per service that the member receives, and they pay it when they receive it. Example, $20 for primary care, $30 for a specialist. Coinsurance is another cost share that a member may have. It's a percentage of cost of the service that the member must pay. For example, 20% for durable medical equipment. Maximum out of pocket, we've already said earlier that all Medicare Advantage plans must have a maximum out of pocket limit known as the MOOP for Part A and Part B benefits. I'll repeat again, this is clearly the medical out-of-pocket maximum. Does not include out-of-pocket costs for prescription drugs. And it is for covered medical expenses. So each year, CMS specifies a mandatory MOOP, which the health plans cannot exceed. However, some carriers will have a lower maximum out of pocket than is mandated by CMS. Each plan maximum out of pocket will be specified in its summary of benefits and in its evidence of coverage. For 2024, the maximum out of pocket for Medicare Advantage, coordinated care plans, and private fee-for-service plans is $8,850, although most plans will have lower limits. PPO plans must also have an aggregate maximum out of pocket for in-network and out-of-network providers, and that number is $13,000 for 2024. And again, it is likely that most of the carriers' PPO plans for in and out of network services will have a lower limit. All Medicare Advantage plans must cover all Part A and Part B benefits. It's important that you understand that, because if you're selling Medicare Advantage plans, you will know that all Medicare Advantage plans must cover Part A and Part B benefits. Most Medicare Advantage plans also cover part of the original Medicare cost sharing for Part A and Part B benefits. Medicare Advantage plans may cover these extra benefits not covered by original Medicare. Additional days of hospitalization. You know that most of the Medicare Advantage plans have unlimited inpatient hospitalization. There are no maximum number of days except for inpatient psychiatric hospitalization. Skilled nursing and rehabilitative services without a prior 3-day inpatient hospital stay. An individual can be sent from their doctor's office to skilled nursing when it's necessary. They don't need to go to the hospital for a 3-day inpatient stay before going to skilled nursing as they would under original Medicare. Most of the Medicare Advantage plans will cover vision services, which would include glasses. That's vision correction, and not to be confused with medical treatment for the eyes or diseases of the eyes. Those are medical specialties. They may have a copay, and that is not the vision service benefit in the plan. Hearing aids are not covered by original Medicare. Routine dental services are not covered by original Medicare. Fitness and gym memberships like Silver Sneakers are not covered by original Medicare. Meals related to a medical condition after hospitalization are not covered by original Medicare. Worldwide, urgently needed and emergency services are not covered by original Medicare. Original Medicare covers services within the borders of the United States. And there are 2 areas, I think, where they will cover in an emergency under original Medicare, if this is still holds true. And that's if you're right across the border in Canada or right across the border in Mexico, and it's a true life-threatening emergency. Original Medicare does not cover non-emergency transportation. So these are things that may be included in any of your Medicare Advantage plans, but are not covered by original Medicare. Medicare Advantage plans may offer special benefits for individuals with chronic health conditions. We've already named them. We already know that not every carrier's chronic plan covers every condition. So you have to know which conditions are in which plans. One of the beauties of being a broker, you have access to more than one company. And if one company's chronic plan doesn't cover the condition that your member or your prospect has, you have options that you can look at other plans. There are 2 categories of such benefits. One is primarily health-related benefits, and those would be the chronically ill ones. Enrollees may include such items as decreased cost sharing for certain services, or supplemental benefits such as at-home palliative care or transportation to medical appointments. Go away. The second is special supplemental benefits, benefits that are not primarily health related. The latter generally address social determinants of health and are known as special supplemental benefits for the chronically ill, or SSBCI. And these may include things such as groceries, meals, beyond a limited basis, pest control, and non-medical transportation. So in those chronic plans, you're going to find even more things that are not generally covered by original Medicare, but are covered in the chronic plans. Consequently, it is useful for agents to know if their clients have conditions that may qualify them for these types of benefits if they are available in the client's area. Exactly what I told you 2 minutes ago. Know which chronic conditions are covered by which plans. Medicare Advantage plans may implement mechanisms to manage the utilization of covered services that do not apply under original Medicare. Such mechanisms include requiring a referral or prior authorization to obtain a service. Plans may also implement step therapy requirements for Part B or Part D drugs. Step therapy is when a plan requires a beneficiary to try less expensive options before stepping up to drugs that cost more. Medicare Advantage plans and dual eligible. These plans generally fall into 4 categories. Number 1, the qualified, the QMB beneficiary, that's the person who has full Medicare. The plans help pay premiums, deductibles, coinsurance, copays for Part A, Part B, or both programs. The second is the SLMB, specified low income, gets help with their Part B premium. Number 3, the QI, Q qualifying individual, gets help paying for their Part B premium. And number 4, the QDWI, qualified disabled working individual, pays the Part A premium for certain disabled and working beneficiaries. QMB, those beneficiaries who just receive assistance paying for their Medicare premiums and cost sharing. So if the person is full Medicare, they're QMB, they're going to get help with all of the things here in this picture. They're going to get costs, their cost sharing is 0. They get help with all of the copays. There's no copays for them for any of these medical services. For QMB Plus, these are the beneficiaries who are also eligible for full Medicaid benefits. And there, as always with insurance, there are some special rules. Special rules apply to all QMBs. When a QMB enrolls in an MA plan, the beneficiary does not have to pay more cost sharing than any minimal copay that would apply under Medicaid. All providers, whether or not they are Medicaid providers or in-network, are prohibited by law from balance billing QMBs for any Medicare cost-sharing amounts. Providers who balance bill are subject to sanctions. Dual eligible beneficiaries may enroll in any type of MA plan except the MA-MSA. Some MA plans, known as dual eligible special needs plans, are tailored to the dual eligible individual depending on the category of Medicaid where they belong. Issues that are important to dual eligible beneficiaries considering MA enrollment include whether the beneficiary is eligible for medical benefits covered under Medicaid. Medicaid may cover items and services not covered by Medicare, but Medicaid will only pay for those items and services if they are furnished by Medicaid participating providers. Note, however, that even providers not participating in Medicaid must hold beneficiaries harmless for the cost sharing of any Medicare covered benefits. Whether the beneficiary will need help to find providers who accept both Medicare and Medicaid to obtain any Medicaid benefits is something that you may have to consider. Here's a case study. Mr. Walsh is a qualified QMB. He enrolls in a Medicare Advantage plan. He goes to his primary care doctor to receive a Medicare covered service. The normal payment is $25. The doctor may only collect from Mr. Walsh any minimal cost sharing allowable under the state Medicaid program, which in Mr. Walsh's case is $25. His doctor may bill the state for the cost sharing, but the whole harmless obligation applies regardless of whether or how much the cost sharing the state would pay. An organization offering coordinated care MA plans must offer at least one MA plan with a prescription drug coverage in every service area. Medicare Advantage private fee-for-service plans have the option of offering prescription drug coverage but are not required to do so. An individual enrolled in a Medicare Advantage private fee-for-service plan that does not include a Part D benefit may enroll in a standalone prescription drug plan, even if under the same Medicare Advantage contract, the organization does offer a private fee-for-service plan with a Part D plan. So you know the rule. The only Medicare Advantage plan other than the Medicare savings account that an individual can add a standalone Part D plan is a PFFS, private fee-for-service. Medicare Advantage, Medicare savings plans are prohibited from offering prescription drug coverage. So in that case, the person needs to get a standalone prescription drug plan. Other types of Medicare health plans. There are other types of Medicare health plans. There's the Medicare cost plans, programs of all-inclusive care for the elderly called PACE, Medicare Medicaid plans, MMPs, other demonstration plans. Medicare cost plans. Medicare cost plans are Medicare health plans that are not Medicare Advantage plans and are not original Medicare. Medicare cost plans may offer Part D prescription drug coverage as an optional benefit, but are not required to do so. Medicare cost plans may offer optional supplemental benefits. Medicare cost plans are available only in certain areas of the United States. In 2023, they were offered in 11 states: Illinois, Iowa, Kansas, Minnesota, Missouri, Nebraska, North Dakota, Oklahoma, South Dakota, Wisconsin, and Wyoming. An individual may enroll in a cost plan and a prescription drug plan. This applies regardless of whether the cost plan offers the Part D coverage. PACE plans, another way of getting coverage. Programs of all-inclusive care for the elderly are Medicare plans for frail elderly beneficiaries certified as needing a nursing home level of care, but still living in the community, not in a nursing home. It's available in most states, but tend to have small service areas and thus may only be available in a few counties. The PACE plan offers an adult day health center where enrollees can get care, meals, and other services. The PACE plan will include comprehensive medical and social service delivery systems using an interdisciplinary team approach in adult day health center, supplemented by in-home and referral services. An individual must be 55 or older to participate in a PACE plan, reside in the PACE organization service area, be certified as eligible for a nursing home care by their state, be able to live safely in a community setting at the time of the enrollment. There's no deductible or copayment under a PACE plan for any drug, service, or care approved by the PACE team or healthcare provider. Beneficiaries with Medicaid pay no premiums. Beneficiary with only Medicare pay a monthly premium to cover the long-term portion of the PACE benefit, and they pay a premium for the Part D in addition to the Part B premium. Medicare, Medicaid, MMPs, these are different from your dual eligible plans. It's a different plan altogether. It doesn't, in most cases, have as extensive coverage of those other benefits as your dual Medicare Advantage PPOs and HMOs will have. So often you are able to move someone who has an MMP in your state from the MMP to a dual plan where they can get more benefit. The choice is up to the beneficiary. MMPs are established under demonstration authority, available only in certain counties in Rhode Island, South Carolina, Texas, California, Illinois, Massachusetts, Michigan, New York, and Ohio. Only certain individuals eligible for both Medicare and Medicaid can enroll in an MMP. Eligibility varies by state. Medicare and Medicaid benefits in some states may offer additional benefits. All MMPs include Part D benefits, and MMPs are not Medicare Advantage plans. Protections and grievances. We're getting to the end. So enrollees in Medicare Advantage plan, Medicare cost plan, PACE plan, or MMP have a right to file complaints, sometimes called grievances, including complaints about the quality of their care. They have a right to get a decision about healthcare payments or prescription drug coverage, and they have a right to get a review or an appeal for certain services. Enrollees protection, the grievance process is used for complaints, and enrollees or their representatives may file a grievance if they experience problems with their healthcare services, such as timeliness, appropriateness, access to and/or setting of a provided health service, procedure, or item. Grievance issues also may include complaints that a covered health service, procedure, or item furnished during a course did not meet accepted standards for the delivery of health care. An enrollee or their representative may make the complaint orally or in writing via an CMS website at www.medicare.gov/Medicare complaint form/home.aspx. Plans must provide a link to the Medicare.gov website where the enrollee can issue a complaint. Mr. Russell went to his in-network primary care doctor for his Welcome to Medicare visit after he enrolled in a Medicare Advantage HMO. His doctor spent 5 minutes with him, which Mr. Russell felt was not long enough to get the services available to him under that benefit. He called his Medicare Advantage plan to complain. The customer service representative assisted him in filing a grievance. The plan investigated his complaint and responded to Mr. Russell. Coverage decisions are determinations made by a medical health plan concerning whether medical care or prescription drugs are covered, how they are covered, and the beneficiary's share of cost. An enrollee has a right to ask for prior authorization, even when it is not required, to find out if a service will be covered under the plan. Here are some examples where an enrollee may ask for a coverage decision. To get a prior authorization for a provider to furnish a service, to obtain payment for certain items or services, such as the type or level of service the enrollee thinks should be furnished, to obtain payment for services when the enrollee is temporarily out of the service area, to continue a service that the enrollee believes is medically necessary, to obtain payment for a prescription drug, to ask for an exception from a plan's formulary. These are all things that when they may ask for an exception. The plans all are required to have an appeals process. It's always in the back of the book. You might point that out when you're doing your presentations for your Medicare Advantage plans to make sure that everybody knows that they do have an appeal process. And if an enrollee is not satisfied with the coverage decision, they, or in some cases their physician, can appeal the decision. Physicians can appeal prior authorization denials on behalf of the patient. An appeal is a formal way to ask the plan to review or change a coverage decision. An appeal can be filed if an enrollee believes the medical health plan did not pay for or authorize a service that should be covered. Where the plan did not pay, the enrollee must be financially liable in order to appeal. An enrollee believes an authorized service such as a hospitalization or home health care is ending too soon. And if an enrollee believes the plan has not authorized or paid for a Part D prescription drug that should have been covered. Medicare health plans must provide enrollees with a written description of the appeal process. Medicare health plans offering a Part D benefit must provide access via a secure website or secure email address on the website for enrollees to quickly request a coverage determination. The plan must also require network pharmacies to provide enrollees with a printed notice when the plan's toll-free number, and website for requesting a coverage determination concerning a drug. For more information, you're going to go to www.medicare.gov, Medicare and You. You can go to the CMS Regulations and Guidance website, or you all know you're going to ask as many questions as you want right here. Hello, everybody. Dee, you had that picture of smiling at me. Are you smiling behind that picture? She disappeared. Okay, what are your questions?
I don't have a question.
Did you
This is
say
Corey
something?
Francis. I just had a comment.
Okay,
I actually felt like I knew some of the information tonight.
you do. That's why I'm going through it so quickly, because I know everybody on here knows all of this stuff. You know it. This is not new. The pieces, I'll tell you right now, the ones that are going to be where we will have more interaction and you'll actually have to talk to me will be 4 and 5.
Okay, I did have a question. What's the rationale besides behind not asking for the month, date, and year they were born? Because the application is going to ask for that.
Yeah, but when you get to the application phase, you have scope of appointment.
I see. Okay, thank you.
You are not allowed under the new rules to ask for that personal information before you have consent to talk to them.
I see. Thank you.
If you have a scope of appointment, you can ask their birthday. But if you are at an event, you know, generally when I'm setting the appointment in the pre-appointment phase, I want to know as much about the person as possible. So when I get them at the appointment, I already know where I'm going with this. They're setting it up so that you cannot ask a lot of that information before you actually get that consent. And for those of you who are also doing ACA, you know that now you got to have consent for that. So it's to make sure that you're not stepping in and getting information that you should not have without the consent of the person to talk to them. So it's okay to ask the question, are you eligible for Medicare? And I know that sometimes when you're doing an event, you see someone walk up and just as a compliment, particularly you men will say, are you sure you're eligible for Medicare? You don't look like you're eligible for Medicare. Are you sure? Wouldn't you do that, Derek?
All the time.
I know you would. I know you would. So you can ask the question, are you eligible for Medicare? You can ask the year of the birth, what year we're born, and you can ask the month. And the month is important to you because if they say 1958 and you're talking to them this year, you want to know, did it come already or not? You want to know if it's 301 or it's 601. Okay, but you won't be able to actually ask all of that information